Perform hand hygiene and don gloves, gown, mask, and eye protection or face shield. Turn the suction apparatus on and set the vacuum regulator to less than 150 millimeters mercury. Use only the amount of suction necessary to remove secretions effectively. Check the negative pressure of the suction apparatus by occluding the end of the suction tubing before attaching it to the suction catheter. Using aseptic technique, open the sterile catheter package on a clean surface, using the inside of the wrapping as a sterile field. Open the package just enough to expose the connecting end and connect the catheter to the suction tubing. Obtain sterile normal saline solution or sterile water to irrigate the suction catheter. Remove gloves, perform hand hygiene, and don sterile gloves, eye protection, and mask, or mask with eye protection and gown if necessary. Check the equipment for proper functioning by suctioning a small amount of sterile solution from the container. Consider administering 100% oxygen for 30 to 60 seconds before suctioning using one of these methods. With the non-dominant hand, increase the baseline FiO2 level to 100% on the mechanical ventilator, or with the non-dominant hand, press the appropriate button on the ventilator to deliver 100% oxygen. With the dominant hand, gently but quickly insert the catheter into the artificial airway with the control vent of the suction catheter open. In patients at high risk for suction-related complications, insert the catheter into the artificial airway until it emerges out of the end of the airway. In patients not at risk for suction-related complications, insert the catheter into the artificial airway until resistance is met, and then pull it back 1 to 2 centimeters. Using the dominant thumb, depress the control vent of the suction catheter to apply continuous suction while completely withdrawing the catheter within 10 to 15 seconds. Using the non-dominant thumb and forefinger, stabilize the airway while withdrawing the catheter. Perform an additional pass of the suction catheter if secretions remain in the airway and the patient is tolerating the procedure. 2 to 4 suctioning passes may be needed to clear secretions. Allow adequate time between passes for the patient to recover before the next pass. Consider administering 1 minute of 100% oxygen after each pass of the suction catheter. Consider administering 100% oxygen for 30 to 60 seconds after suctioning. Monitor the patient for adverse reactions. Return FiO2 to the baseline level after suctioning is complete. If the patient does not tolerate open suctioning despite administering 100% oxygen, ensure that FiO2 is set at 100%. Maintain PEEP during suctioning. Allow longer recovery intervals between suction passes. If the patient does not tolerate open suctioning after these steps, switch to a closed suction technique. Perform oropharyngeal suctioning using the same suction catheter or a Yankauer suction catheter when the lower airway has been adequately cleared of secretions. Rinse the catheter and connecting tubing with sterile normal saline or sterile water until the tubing is clear. Wrap the catheter around the dominant hand after the upper airway suctioning is complete. Pull the glove off inside out. The catheter remains in the glove. Pull the other glove off in the same manner and discard. Turn the suction device off. Ensure that the FiO2 is returned to the baseline level.